Your kidneys get weaker with age, but one healthy supplement can push them over the edge after 65. And the scariest part is this: you can damage your kidneys slowly and feel nothing at first. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this all the time, and you don't want to miss the next one. Here's the thing. I've watched the same pattern for years. A person hits their late 60s or 70s. They try to do the right thing. They add a supplement for pain, swelling, joints, or inflammation. And then, months later, their lab work shows their kidneys are struggling, not because they were careless, but because they trusted a bottle that looked safe. Today, I'm going to show you the healthy supplement doctors keep warning about for older adults. I'll explain why it can be risky after 65, and I'll give you simple, safer options you can actually use. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think natural means gentle, but your kidneys do not care if something came from a plant or a lab. Your kidneys care about one job: filtering your blood every minute of every day. Think of your kidneys like the filters in your home's air system. When the filter is new, air flows fine. But when the filter is older and clogged, even a little extra dust becomes a big problem. After 65, your kidney filter often isn't as strong as it used to be. And now let's talk about the supplement. The supplement that causes the most surprise kidney problems in older adults is high-dose turmeric or curcumin pills. Most people take it for joint pain, or arthritis, or inflammation, which means swelling and irritation inside the body. And to be clear, turmeric as a spice in food is usually not the main issue. The bigger risk is concentrated pills and powders taken daily, often in large doses. Why would something used in cooking be a kidney problem in pill form? Because supplements can pack a food into a superdose, like turning a small campfire into a bonfire. And there's a key word you need to know today: oxalate. Oxalate is a natural chemical found in many foods. The body must get rid of it, mostly through urine. But when oxalate gets too high, it can form sharp crystals, like tiny pieces of glass. Those crystals can lead to kidney stones, and in some cases, they can injure the kidney tissue itself. A medical term you may hear is oxalate nephropathy. That just means oxalate damage in the kidneys. Now, I want you to hear this clearly. Not everyone who takes turmeric will have kidney trouble. But after 65, your risk can climb, especially if you already have kidney disease, dehydration, frequent diarrhea, or you take certain medicines. And there are real reports showing this can happen. A 2024 case report described a 69-year-old man who developed kidney failure in the setting of chronic turmeric supplementation. His kidney biopsy showed calcium oxalate crystals, and he reported taking 2 grams of turmeric daily for 2 years for pain relief. After stopping turmeric and changing his diet and routine, his kidney function improved enough that dialysis was stopped. Source: that's not meant to scare you. It's meant to wake you up. Because if you're over 65, you don't have the same margin of safety you had at 45. Now let's get practical. I'm going to give you 5 key points in a reverse countdown. Number 5 is important, but number 1 is the one most people never see coming. Number 5. The more is better. Trap. Most people think, if turmeric helps a little, more will help more. But actually, more can mean more oxalate load. Remember, oxalate is like grit in a pipe. A little might pass through. Too much can clump up and scratch things. In that same 2024 medical case report, the person's history included 2 grams of turmeric daily, and the report explains turmeric has a relatively high oxalate content. The patient's testing showed high urine oxalate levels, and the biopsy confirmed oxalate crystals inside kidney tubules. Source: so what do you do with that? First, look at your turmeric bottle. If you see 1,000 milligrams, 1,500 milligrams, or 2,000 milligrams per day, that's a red flag for many older adults, especially if you take it every day. Second, ask yourself a simple question. Am I using this like a spice or like a drug? Because many people are using it like a daily drug without realizing it. Third, try the simplest step first. If you love turmeric, use it in food instead of pills. For many people, that means about 1/4 to 1/2 teaspoon of turmeric powder in soup, eggs, or beans. And here's the kitchen trick that helps it work better at lower amounts. Add a pinch of black pepper and a fat source, like olive oil. Pepper contains piperine, which can increase absorption of curcumin. Now, a quick question. Have you had kidney stones before? Even once? Comment yes or no below. Because if you have a history of stones, you need to be extra careful. But wait until you see number 4, because this is where seniors get blindsided. Number 4, dehydration turns a small risk into a big one. Most people think dehydration only matters when you feel thirsty, but actually, your kidneys need steady fluid to flush waste out. After 65, your thirst signal can get weaker. That means you can be low on fluid and not even know it. Think of your urine like a river carrying away trash. When the river is full, trash moves downstream. When the river dries up, trash piles up. If you take a high oxalate supplement and you're not drinking enough, you increase the chance of crystals forming. The 2024 turmeric-related kidney case also included chronic diarrhea in the patient's history, which can lead to fluid loss and changes in the gut that affect oxalate handling. Diarrhea can be like a slow leak in your hydration tank. Source. So here are detailed, practical steps that are simple. When you wake up, drink 8 to 12 ounces of water before coffee. With lunch, drink another 8 to 12 ounces. Mid-afternoon, drink 8 ounces. With dinner, drink 8 to 12 ounces. That's often 32 to 48 ounces total, which is a common goal for many seniors. Some people need more, some need less. But listen carefully here. If you have heart failure, swelling, or you've been told to limit fluids, do not force extra water. Ask your doctor what amount is safe for you. Now let's talk food, because food can help your kidneys buffer oxalate. A simple trick is calcium with meals. Calcium can bind oxalate in the gut, so less oxalate gets absorbed. That can look like 1 cup of milk or yogurt with a meal, or about 1 to 2 ounces of cheese. If you don't do dairy, calcium-fortified soy milk can be an option. And yes, I know that sounds strange. Calcium is often blamed for stones, but calcium in food with meals can actually reduce oxalate absorption for many people. It's about timing. But wait until you see number 3, because it's not just turmeric that matters. Number 3, the combo problem. Most people never track. Most people think one supplement is one supplement. But actually, it's often the combination that overloads your kidneys. Here's a common combo in seniors. Turmeric pills for joints, vitamin C for immunity, and maybe a greens powder for health. The problem is that vitamin C, especially in high doses, can turn into oxalate in the body. The turmeric case report itself lists megadoses of vitamin C as a dietary precursor that can raise oxalate and increase risk for calcium oxalate problems. Source. So what's a megadose? For many people, that's 1,000 mg per day or more, especially when taken long-term without a clear reason. This is where you keep it simple. If you want vitamin C, start with food first. 1 orange has about 70 mg. 1 red bell pepper can have over 100 mg. 1 cup of strawberries has about 85 mg. That's real vitamin C, packaged with fiber and water. If you still want a pill, many older adults can do fine with 100 to 200 mg per day, but you should ask your clinician what fits your health history, especially if you have a history of stones or kidney disease. And let me be clear, I'm not saying turmeric is poison. I'm saying the stacking effect is real. And after 65, you often need less, not more. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now let's go to number 2, because this is where normal lab tests can fool you. Number 2, my kidney numbers are fine, can be misleading. Most people think kidney damage always causes pain, but kidney problems can be silent, and many older adults only find out after routine lab work shows changes. You may hear the term creatinine. Creatinine is a waste product from muscles. Doctors use it to estimate kidney filtering. That estimate is often called eGFR, which means estimated glomerular filtration rate. That's just a long phrase for how much blood your kidneys filter per minute. Here's why this matters. Some supplements can raise lab values or confuse the picture. And even if your labs were normal last year, that does not mean you have a free pass now. This is why doctors often say, treat supplements like medicines, especially after 65. UCLA Health has warned that people with kidney disease, or those taking medications that affect kidney function, should speak with their physician before starting supplements like creatine, even though creatine is considered safe for many healthy adults. The key point is not all supplements are bad. The key point is your kidney situation matters. Source. So what do? You ask for two simple things at your next visit. Ask for a kidney function test, like creatinine and eGFR, and ask for a urine test for protein. Protein in urine can be an early sign your kidneys are stressed. Then you bring your supplement bottles, not a list. The actual bottles, because labels and doses matter. And now, number 1. This is the biggest mistake, and it's why people get hurt even when they think they're being careful. Number 1, hidden kidney stress from natural pain plans. Most people think turmeric is just a natural anti-inflammatory, but actually, many people take turmeric because they are trying to avoid NSAIDs like ibuprofen or naproxen. NSAIDs are common pain pills. They can hurt kidneys in some people, especially with age, dehydration, or other medicines. So seniors switch to turmeric and feel safer. But the truth is, you need a complete pain plan, not a single magic supplement. The 2024 case report is a perfect example of why. The patient's history included chronic pain, prior NSAID exposure, chronic antibiotic use, diarrhea, and then high-dose turmeric for years. It was a whole chain of stressors, not one simple cause. Source. This is why doctors say your kidneys don't get damaged by one dramatic event most of the time. They get damaged by slow pressure, like a roof leak that rots wood for months. So here is a safer, simple pain plan you can discuss with your doctor. First, try movement snacks. That means 3 to 5 minutes of gentle movement 2 or 3 times a day. Not a workout, just motion. Many joints hurt more when you're stiff. Second, use heat for 15 to 20 minutes on sore joints. Heat increases blood flow and relaxes muscles. Third, consider topical pain relief, like a cream or gel before you take pills. Topical means on the skin. It may lower whole body side effects for some people. Fourth, if you still want turmeric, lower the dose and use it as food, not a megadose capsule. And do it with meals. Fifth, if your pain is new, severe, or getting worse, do not cover it up with supplements. Pain is a signal. It deserves a real check. I'd love to hear your story. What made you click on this video today? Share in the comments. Now, let's pump the brakes for a second, because if you're thinking, should I stop my turmeric today? You need to hear this carefully. I'm not saying everyone over 65 must quit turmeric. I'm not saying turmeric is always dangerous. I'm saying high-dose turmeric supplements can be risky for some older adults, especially if you have kidney disease, a history of kidney stones, dehydration, chronic diarrhea, or you take medicines that affect your kidneys. And you need to watch for warning signs. Call your doctor soon if you notice swelling in your ankles, less urine than normal, foamy urine, unusual fatigue, nausea, or new shortness of breath. Also be careful with interactions. Turmeric can affect blood clotting in some people. That matters if you take blood thinners. Blood thinners are medicines that reduce clots, like warfarin or other prescription options. Turmeric can also upset the stomach in some people, and the biggest danger is this: self-treating for months while kidney function slowly drops. If you have known kidney disease, or you've been told your eGFR is low, do not guess. Ask your clinician before taking concentrated supplements. Now you're convinced, but thinking, how do I actually do this? Here's the simplest path. Step 1 is not to panic. Step 1 is to check your dose. If you're taking turmeric pills daily, consider a 2-week pause and talk to your doctor, especially if you have any kidney history. If you still want the benefits, use turmeric in food a few times per week instead of high-dose pills. A simple routine looks like this. Add 1/4 teaspoon turmeric to a pot of soup, chili, or scrambled eggs. Add a pinch of black pepper. Add a teaspoon of olive oil or cook it with eggs. That's it. If joint pain is the reason you take it, focus on the basics that protect kidneys too. Drink steady fluids through the day unless your doctor limits fluids. Eat real food vitamin C instead of megadoses, most days. Get calcium with meals from food if it fits your diet. And move a little every day. Motion is lotion for your joints. If money is tight, good news. Turmeric as a spice is cheap. Walking is free. A heating pad is a one-time cost. And simple meals do more than expensive pills if you do them consistently. Look, there's a lot of noise out there. And supplements are marketed like they can do anything. But you don't need to overthink this. After 65, your best move is usually not more supplements. It's safer habits and smarter doses. Start with just this one action step. Go look at your turmeric dose today. If it's high, don't ignore it. Your body will tell you if it's working. Through energy, swelling, urine changes, and your lab results. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.